Hey there, my name's Melissa and I'm here to talk to you about how to study in nursing school. Now we all know that this is really a challenge, right? You probably think to yourself, I did fine in high school. I even did fine in my arts and sciences classes, but once I get to these nursing classes, I have no idea how to pass this class. I don't even have any idea how to study. Well, I'm here to help you out. I have been helping college level nursing students for a very, very long time. And over the years, I've talked to the students who have been successful and I've worked with them and I found out what works for people. And I have found out the best things that help people through nursing school. So I've kind of put them all together in this PowerPoint here, and we'll go through that and we'll talk about what it means. All right, so the first one is, just a second, there we go. It's a 5-step process. Now, the first step is to obtaining the information. Then we organize the information, we analyze the information, teach it, and then apply it. So what the heck does that mean? Let's start with obtaining the information. So where do we get our information from? So this Ignovicticus book, this is a medical surgical textbook. I would say go with whatever medical surgical textbook that you are required to have in your nursing school. That is the one that you should use. You should also rely on your theory instructors and their PowerPoints. That is the most important place to get your information along with your book. Okay, what other sources? So Saunders or any NCLEX style practice question book. They usually have information in there that is related to the type of details about content that you would have on an NCLEX. It'll tell you highest priorities and biggest issues with these disease processes and things like that. So NCLEX books are great to kind of help you narrow things down and figure out what's the most important aspect of all of this information that I just got about this disease. NCLEX books will help you kind of bullet point those things, and so they're kind of good for a big picture. One technique that I always talk about is the zoom in, zoom out method. So the zoom in method is all those details that you get from your teacher and from the book, right? That's the first thing. But that can be very overwhelming. The zoom out method is the big picture, the big concepts. Like, for example, if you're studying Parkinson's disease, you can figure out, okay, well, I know I'm supposed to give them cold, thick liquids. I know I'm supposed to have suction at the bedside. I know I'm supposed to have them not look at their feet when they're walking. I'm supposed to not rush them in the morning. So you have all these lists, right? But if you hit the zoom out method, the zoom out button, then what you realize is all of these things that the nurse is doing and all of these things that you're driving yourself crazy trying to memorize all have to do with preventing aspiration and falls, right? So that's the zoom out. And so that can be very helpful on test questions because you'll be looking at all the information and you'll say, oh my gosh, I'm so overwhelmed. I don't remember. All of the details are getting jumbled in my brain. I don't remember if that was Parkinson's or MS. I don't remember. But you can say, wait a minute, let me take a step back for a second. Let me zoom out and say, okay, the big picture of Parkinson's is we're trying to prevent aspiration and falls. So which one of these does that? Okay, so that's the zoom in, zoom out method. So any NCLEX style book is very helpful. YouTube can also be helpful. I caution YouTube because the sources vary. So I wouldn't get my details from YouTube. I would get my concepts from YouTube. YouTube is great if you're a visual learner. YouTube is great if you want a different perspective other than the one that your instructor has given you. But again, YouTube needs to be for concepts only, big picture type stuff, okay? We don't want to get details. If your book says that you have to call the doctor if a JP drain has 150 mLs out in 2 hours, then that's what you go with. If YouTube says that it's 200 in 2 hours, you go with what your book says, okay? So we're not going to use YouTube for details. We just use those for big concepts. Okay, moving on. What information do I really need? You want to think about when you get information out of your book or from your teacher, you want to say to yourself, well, how would this help me as a nurse? What would I do with this information? Do I really need this information? And if I do, what would I do with it? How does it pertain to me as a nurse, to my job? And then you want to say, would it fit the nursing process? Does it fit into ADPI somewhere? Is it part of my diagnosis? Is it part of my assessment? Is it part of my intervention? Is it part of my evaluation? What is it? Next step, step number 2, organize. So we're going to organize our information. This is going to be things like creating study guides, concept maps, or organized notes. Now there's 2 ways you can do this. You can either figure out the format that works best for you, whether it be concept maps, a study guide format with headings, or just organized notes. And you can take that template into your classroom with you and take your notes on that template so that you only have to do it once. Most students don't do it that way. Most students will take the information that they get in class, their notes, they'll combine it with what they've seen in the book, and they will then reorganize it into a nice concept map or a nice study guide with headings or very organized notes. So we want our information organized. So for example, if you're doing Parkinson's, MS, and say seizures, you would want, for each of those, you would want what the patho is of that. And you want to keep the patho very simple. One person that I work with always says, break it down Crayola style, right? So you want to keep that patho 1 to 2 sentences in as few words as possible and in your own words. And that's true for anything when you're organizing your information, taking stuff out of the book, taking it from the teacher. Don't write it down unless you understand it. So if you don't get it, take a sticky note, jot down the concept on a sticky note, and stick it on top of the paper. Don't write it in your concept map. Because if you write it in your concept map, like for example, if you're writing about the pathophysiology of Parkinson's, and you simply just copy out of the book the patho of Parkinson's and you put it on your sheet, did you learn anything? No, you didn't. You didn't learn anything because you've just copied and pasted, basically. So you want to put the information in your sheet in your own words. That way it has went from your book and your teacher into your brain, it has processed, and then it has come out on your paper in your own words. So you have already processed it once, okay? So this will help you with staying organized and already starting to learn that information. So keep the patho very short and sweet. If you don't get the patho, don't just copy it. Shoot an email to your teacher. Ask them, can you please explain this to me in simpler terms? That's their job. That's what they're supposed to do. And if you a theory teacher can't help you out, you can always go to your lab instructor or your clinical instructor. They can help you out as well. The next category that you want to have on your organized information are risk factors or causes. So you want to have these listed out, but if there's anything that you can see that's in common, then you want to take care of that as well. So for example, if several of the risk factors for a disease all have to do with vasoconstriction, then you might want to make a little note next to that, right? For example, if you're learning about Raynaud's disease, right, and you see that all of the risk factors for a Raynaud's exacerbation have to do with vasoconstriction, because cold, smoking, stress, caffeine, they all peripherally vasoconstrict, so they all will cause a Raynaud's flare-up. So this is why we go ahead and we'll put next to each of those things vasoconstriction in parentheses, so that reminds you that's your zoom out, right? So you have your list of everything here, but next to it you have vasoconstriction, so you can see that they have all of them have that in common. So now you can safely conclude, oh, okay, well, most of the things that cause Raynaud's have to do with, or cause a Raynaud's exacerbation, have to do with vasoconstriction. So now you have your zoom in, which is all your details, and your zoom out. Next, we have diagnostic exams and lab values. You want to make sure that you have those in there as well, because those diagnostic exams are very important, and you know that there can be questions on the test about those diagnostic exams. So you want to make sure you put the considerations in there as well. For example, if you have somebody getting a CAT scan with IV contrast, you would always want to make sure that you remember to check the BUN and creatinine and the GFR before, because IV contrast is hard on the kidneys. Signs and symptoms, expected versus unexpected. So you want to make sure you have both of those in there. Meaning, signs and symptoms expected means when I walk into the room, I got a report that this patient has Parkinson's. Okay, I'll keep using that. When I walk in the room, I expect to see maybe a mask-like face. I expect that patient to shuffle his feet when he walks to the bathroom. I expect cogwheel rigidity. I expect pill rolling. I expect to see all these things. It's no big deal. That's what you get when you have Parkinson's. Now, the unexpected findings are the findings that you think to yourself, okay, I got a report that this patient has Parkinson's. Now, I know I'm going to see these things, but if I see this, this is a sign that a complication has occurred and I need to call the doctor right away. So for Parkinson's, it would be, for example, shortness of breath, rhonchi in the lungs, a new onset cough, they fall when they walk to the bathroom, or they're very, very unsteady on their feet. Those are all things that you would call the doctor for. Anything new that has come up, and those signs and symptoms of a complication. Speaking of complications, you'd want to make sure you have on your organized notes what complications are of that condition. So, you know, for Parkinson's, it would be aspiration and falls, right? And then we have patient teaching. So we have make sure that you know what the patient, what you want to teach the patient. That's very important. We want to make sure that we have the information and that we know what to teach the patient, because you know when you have test questions, there's always things on patient teaching. Patient, which ones show that the patient understood the information, which ones show that the patient needs additional teaching. We always know that those are on there. And then we have treatment versus treatment and treatment considerations. So that would be meds or therapies, surgeries. Those are all things that you would put in there. And then treatment considerations. Like, for example, if you're doing Parkinson's, again, a treatment would be carbidopa, levodopa, or Sinemet. And a treatment consideration of that would be they need to make sure they take it on an empty stomach. Okay, or you may be giving the patient selegiline, an MAOI inhibitor. We might be giving them that. And then a treatment consideration is avoid tyramine foods. But now you have to remember, you can't look at a patient and go, avoid tyramine foods. You want to say, avoid tyramine-containing foods, such as aged food, aged wines, cheeses, aged cheeses, summer sausages, things like that. So you want to give them some examples. And then obviously we'd want to have those nursing interventions in there. And a nice thing to do with nursing interventions is next to each one, just like you do with risk factors and you can do with symptoms as well, put in parentheses next to it, what is the goal of that intervention? Like, for example, if you put suction at the bedside as a nursing intervention for Parkinson's, you would put in parentheses, prevent aspiration, so that you know that's your big picture. Okay, that's your zoom out. Okay, the next step is analyze the information. Now, this is very important because this is where we separate memorization from understanding. It's going to be very hard for you to get through nursing school on memorization alone. Remember, nursing students cannot live by memorization alone. You have to understand. Now, some people will call this the why, work the why, right? Why do we do that? Why is that a symptom? Why is that a cause? How does that interconnect in the body? What's going on? A lot of the things will link back to pathophysiology. But we want to keep the understanding of patho very simple. Short, simple, and sweet, right? We don't want to be the nursing student Alice in Wonderland who falls down the patho rabbit hole and can't get out, right? So we want to make sure that we just keep it really simple. Like if you're talking about Parkinson's again, and you say that, instead of messing with the substantia nigrans and all of that, just say, Parkinson's causes a lack of dopamine, or it's caused by a lack of dopamine, and dopamine deals with controlled muscle movement in the body. So now if you think about symptoms, nursing interventions, they all will link together, and patho is kind of like the glue that links everything together, kind of makes everything make sense. So when you are, analogy that I use is memorization versus understanding. Memorization is where you have a card table and you have all the puzzle, you're going to work a puzzle, and you have all the puzzle pieces laid out for you, right? You may even take those puzzle pieces and put them in categories. Okay, so you have all of the puzzle pieces that have flowers on them over here, and the sunset ones are going to go over here, and the ones that look like they have mountains on them, we're going to put those over in the middle. You might even put the straight edges in a pile together, right, because we're going to work the border first. Here's the thing. Memorization in nursing school is like having all the puzzle pieces on your table, categorized even, but that's it. You can't see the picture because you don't have them put together. Now, understanding, kind of working that patho in there, the understanding will actually make those puzzle pieces fit together. For example, we know that dysphagia is a issue with Parkinson's. Now, we also know that one of our nursing interventions for Parkinson's is to keep the head of the bed up. So if we now say, okay, we have a head of the bed puzzle piece and we have a dysphagia puzzle piece, let's put those together. Oh, we have a connection here. Oh, we keep the head of the bed up for Parkinson's patients because they have a risk of aspiration with dysphagia, right? So you're connecting the puzzle pieces together. Click those pieces together and then you'll start to see the picture form, that big picture, right? So this is why we do the why. This is the analysis part of it. Very important step. Don't skip it. That is usually when people start to understand the why, that is usually when I see students go, oh, the light bulb goes off and they get it. So make sure you're working that why. And working the why is also important because, what about the patients? The patients, they need to know why about things as well. So we want to make sure that they know the why as well. Okay, so the next part is teaching. Teaching is very important, and this is one that a lot of students skip, and the students that skip it wish that they hadn't. Okay, so you want to work with other students, or you can work with a family member. You can record yourself. You can stick a teddy bear or your dog in front of you and teach them. It's good with another human being, though, if you can. And you want to say that that person is your patient, and you're the nurse, and you are going to teach them about their condition. And you're going to explain it in Crayola terms, right? You're going to teach it at what they say like a 3rd grade level, okay? And if you can explain it in that level, you know you've got it. So a lot of students will skip this part and go right to practice questions. But here's the thing. Practice questions aren't going to test your knowledge on every single aspect. This one does. So use this. This is very important. And if you're in a group of students that you're studying, you can make assignments. So you can say, okay, I'm going to teach about Parkinson's. How about you teach about MS, and how about you teach about stroke? So what happens then is if you end up being the patient in the situation, okay, say your fellow student is going to be the nurse and they're teaching you, then you would say, when the student, have your notes in front of you, okay, and when the student is teaching you, if they miss something, you can go, excuse me, I read on WebMD that da-da-da-da-da, and you would kind of take on the role of the patient and you don't want to give them the exact information that they missed, but you kind of want to give them a little clue, right? So they can try to figure it out. So that's a really good way to make sure that you understand not only the aspects of the disease, but the concepts and all of the whys of the disease. Because remember, if you're actually speaking to a patient, are you just going to sit there and hold your sheet of paper and recite lists? Okay, the pathophysiology of this disease is, the risk factors are, the symptoms are, the complications are. No, you're not going to do that. You're going to say, okay, Mr. Jones, you've been diagnosed with Parkinson's disease. So what that means is you don't have enough dopamine in your brain. And you're probably thinking, what is dopamine? Well, dopamine helps control your muscle movement. And so, here are the symptoms that you can expect to see. So you are gonna might start moving a little bit slower than you did before because the dopamine can't control those muscles as well as they used to. So you start linking everything back to the patho and really trying to explain it. And that is a good teaching, and that is what's going to help you understand that disease process more. Then finally, we move on to applying the information. Applying the information is practice questions. So we say to ourselves, a lot of students will say, okay, I look over my notes and I do practice questions. And that's how they study. So the problem with that is, number one, that's too passive. Looking over notes is too passive. Reading your book is too passive. You need to immerse yourself in this content. You need to smother yourself with it, okay? You need to get into it, interact with it. That's what you need to do with it. That's where the teaching comes into play. That's where the organization and the analysis come into play. Really getting involved in it. Is it a lot of work? You bet it's a lot of work, but it's a short-term sacrifice for a long-term gain. It will pay off for you. Don't use the practice questions to see if you know the content. That's not what they're for. You should know the content before you get to the practice questions. That's what the teaching is for. But the practice questions are there to make sure that you know how to apply the content. So they're there to make sure that you know how to answer those NCLEX style questions using the knowledge that you have, that you've learned by studying. You can't apply what you don't know. So you've got to know the content before you get to these questions. Otherwise, you're wasting your time. When you're looking at the question, you want to say to yourself, what is the question asking me? Put it in your own words. And then for each answer, you want to say, what is it? Why is it wrong or why is it right? Write out your own rationales. And then by doing that, you're working a lot of content in one question, number one. But number two, you're starting to figure out how distractors are created and why those distractors are put in there. I definitely say try to do at least 5 to 10 questions a night on the topics that you studied that day, because what that will do is that will go in and reinforce what you've learned, right? And we talked about this already, looking at once you have your own rationales, look at the actual rationales of the question, like in the back of the book, and see how well your rationales compared to those rationales. Did you get it right for the right reasons? Or did you just have a good guess? Or was your rationale completely off even though you still got it right? I've had that happen a lot of times with students as well. All right, so that's really how you study for nursing school, and hope to see you again soon.